Why a deadly fungus from the American Southwest is approaching Canada. Valley fever, the secret danger in Arizona. Last year, Vivek Patel, a 30-year-old metallurgist from Brampton, Ont. went during a time-long experience attempting to sort out the thing that was causing the devastating migraines and serious shortcoming he created in the wake of visiting Phoenix, Arizona, for a new employee screening. He spent 7 days in the city, going on road trips with his significant other to visit the general red stone arrangements of Sedona and the notable Fantastic Gorge. After he returned home, Patel skipped between specialists in Toronto and confronted a battery of tests, from blood work to a CT sweep to a spinal tap, yet nothing prompted an authority finding. It was only after Patel found the work, and authoritatively moved to Arizona that September, that he at long last found a solution. During an eye examination in Tucson, an ophthalmologist saw Patel's optic nerve, which associates the eyes to the mind, was crunched into an oval shape as a result of strain inside his head. Patel went through one night in a trauma center, and later imploded working. At long last, his Arizona clinical group raised the chance of valley fever, which he learned had caused both meningitis, the possibly dangerous enlarging of the mind and spinal ropes defensive films, and hydrocephalus, a development of liquid in pits profound inside the actual cerebrum. It was only after the specialists began showing me the X-rays and CT examinations that I understood. This is very significant, Patel said. He is as yet taking medicine to keep his side effects under control, and cerebrum filters required before this year showed his migraines and general shortcoming were improving, however not completely gone, because of his treatment. What is valley fever? Valley fever, otherwise called coccidioidomycosis, is a contagious disease brought about by breathing in spores of the parasite Coccidioides amytis or Coccidioides posadaceae. These spores are tracked down in the dirt of dry locales, like the southwestern U.S., including Arizona, New Mexico, and California. At the point when the dirt is upset, for example, during development or windstorms, the spores become airborne and can be breathed in. Side effects of valley fever can shift from gentle to serious and may incorporate fever, hack, chest torment, weakness, migraines, and muscle throbs. At times, the disease can spread past the lungs to different pieces of the body, like the bones, skin, and mind. This can prompt more serious entanglements, including meningitis and hydrocephalus. Diagnosing and treating valley fever. Diagnosing valley fever can be tested in light of the fact that its side effects are like those of other respiratory ailments. Notwithstanding, in the event that a patient has as of late gone to an area where valley fever is predominant and is encountering side effects, for example, a persevering hack or chest torment, specialists might think the contamination. To affirm the finding, specialists might play out a blood test to check for antibodies against the parasite or a sputum culture to distinguish the presence of the growth. Imaging tests, for example, chest X-beams or CT examines, may likewise be finished to survey the degree of the disease. Treatment for valley fever as a rule includes antifungal meds. These prescriptions help to control the disease and reduce side effects. Nonetheless, it's critical to take note that antifungal meds don't kill the parasite yet rather smother its development. In serious cases, hospitalization might be required, particularly assuming that the contamination has spread to different organs. Forestalling valley fever. Forestalling valley fever principally includes staying away from openness to the parasitic spores. Assuming you live in or are wanting to visit a region where valley fever is predominant, avoid potential risk. 1. Remain inside during dust tempests or breezy circumstances. 2. Use air channels or purifiers in your home to diminish the quantity of spores in the air. 3. Wear a cover while working in dusty conditions, for example, building destinations or farming fields. 4. Try not to upset the dirt however much as could reasonably be expected, particularly in the event that you have a debilitated resistant framework. End. Valley fever is a secret danger in Arizona and other bone-dry locales of the U.S. It can cause a scope of side effects, from gentle to extreme, and can prompt serious entanglements whenever left untreated. In the event that you are encountering side effects like fever, hack, or chest torment subsequent to visiting or dwelling in a space where valley fever is common, look for clinical consideration expeditiously. Early determination and treatment are significant for an effective recuperation. Make sure to go to preventive lengths to lessen your gamble of openness to the parasitic spores. Remain informed and remain safe. Thanks for watching.